And let me wish all our mothers that are out there a happy Mother's Day, which is coming up this Sunday. And hopefully have beautiful weather as we had this past weekend. I just wanted to, the mask here, the Springfield Strong mask, I want to thank Ileana Gutierrez from my Senior Elder Affairs Department for making them. Very nice of her to do that, and also very hopeful to each and every one of us. So I'm just going to take this off for right now. Thank you, Ileana. I hope everybody had a good weekend. I'm very thankful that our sign language lovely young ladies are here. Again, thank you very much. And again, I'm very grateful, as always, that Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Roos, Chief Medical Officer for Mercy Trinity Health Systems, are here. We deeply appreciate that and all your continued efforts of your entire staff. It's been tremendous. Patrick Leonardo is here, Operations Director Manager for AMR. We appreciate your collaboration, especially at our homeless triage medical facility that we have. Just to let you know, knock on wood, but we have to be ever vigilant. There seems to be a trend that is occurring. While our total numbers of positive cases is 1,484, we've seen a trend start. We are 48 Thursday, 48 Friday, but we saw Saturday dip to 33. We saw Sunday dip to 16 on that. So, but we have to stay ever vigilant. On the homeless front, and again, I really want to thank, again, Helen, my Commissioner of Health and Human Services, Helen Carlton Harris. She's done a yeoman effort, that tenting, and Pat Sullivan and Tim Sheehan, and also the partnership with Bay State Health Systems. They have been tremendous. Good news there, and we have about 150 homeless individuals who stay at times at the Friends of the Homeless. So the first 58 tested have come back negative, and we're very thankful and happy about that. Another 50 and 50 will continue to be tested, and that Dr. Kerouac shared some great photo shots of the Bay State nursing crew there in the triage tenting, doing the testing, and we appreciate that immensely. Mercy Hospital has stepped forward too. Ronnie Willoughby for Springfield Rescue Mission does a great job with his program. Helen was always checking in with him, and he was doing fine. But he had asked us, Helen, I believe, last week sometime, or early last week, I need some help with the testing. And Mercy Hospital is stepping up to test. I believe they started Friday there, so thank you very much there. And again, Springfield comes to the rescue pertaining to the Western region, helping out Amherst and Northampton on the homeless testing. Doreen Faddis of Mercy. Our Springfield crews have helped at Ron Willoughby's Springfield Rescue Mission, but we also helped for the city of Northampton and Amherst, 172. Commissioner Helen Carlton Harris has informed me have been tested there. And that's all coming out of my Springfield initiative on that. I want to thank the Friends of the Homeless also, Bill Miller, Karen Jeffers. They've been great. I really appreciate that. So those are positive, that's positive news. The deaths, I think last time we reported to you that we're aware of, and Commissioner Carlton Harris and her dedicated staff scrubbed the list. We're at 21, we're at 22 that we are knowledgeable of or aware of, 22 deaths. And God rest their souls, and my sympathies and thoughts and prayers go out to each and every one of their families. We had our weekly meeting with Chairman Neal, Congressman Neal, and he continues to advocate very strongly for us on city and state funding, maybe going back to the old days of revenue sharing and the conduit. Hopefully it would be through CDBG money. He told me an interesting fact, and Tim Sheen will get a kick out of this. Back in, Timmy, I think he said the 70s or early 80s, $11 million coming in through CDBG. We now get about $4 million. So just if you fast forward that. We've also spoken to the congressman to try to bring some type of relief with water and sewer. As you know, they've taken a massive hit, and the board has put across that there's going to be somewhat of an increase. Would have been an increase anyways. We have one of the best water systems in the country, if not the world. But always I told them we need to be cognizant of our ratepayers. But they've taken a massive hit, and they have to continue to invest in infrastructure, capital programs. Some of those mains are 100 years old. And again, we're not going to let a Flint, Michigan occur here in the city of Springfield. We also spoke with the congressman on, in turn, infrastructure program, which we're hopeful after this last tranche of money coming in, he would look to pursue the infrastructure. We had our weekly meeting with the state delegation, and I appreciate the state delegation's continued efforts. And we spoke about economic development and small businesses. Also asked them to see if the state could step up and maybe do some more funding for our small business as the city of Springfield has. I want to thank recent donations that have come in. Frank Colacino, and this came from Holistic, which is one of our recreational marijuana providers up in Boston Road. 200 KN95 masks have come in. We appreciate that. Thank you to Frank Colacino and Holistic, recreational marijuana. We received another thermal infrared thermometer, anonymous donation, which we need desperately on that. And my Chief of Staff, Tom Ash, matter of fact, is on his way. J. Polyp Distributors, a family-owned distribution company, has been around for years, if not, I don't want to say 100 years, but many, many years. They've donated 750 surgical masks, and I want to thank Senator Eric Lesser, who was the conduit for that. And speaking of masks, my first priority has been to continue to be able to provide for our frontline service people, whether police, fire, DPW, you name it, everybody that's out there, because city business continues to go on. But Commissioner Clapprood and I, and we're hopeful, as long as we have enough supply, because we are the reopening plans are being put in place, and I have to make sure that our city workers have enough masks. But Commissioner Clapper and I believe that we're going to start to try to pursue, starting probably this week, our police officers handing out masks, surgical masks. We want to be proactive, educational to the residents of the community, making them aware. Depending on the supplies that we have, we probably would try to keep that going into the weekend before you start with any type of warnings or penalties. Again, Governor Baker has ordered masks should be on, especially when you're out in public and going into stores or areas where there might be a number of people. And even though we're starting to see a trend, and I think you'll hear that from Dr. Kerouac and Dr. Roos, we have to be ever vigilant. We can't let our guard down. So let's face it, it's going to be a fact of life for right now that you're going to have to wear a mask. That includes businesses now. They're going to have to enforce that. We will enforce to the best of our ability, but we want to make sure that we are proactive. And, confrontational is not what we're looking to be. But we hope that people will show enough respect, not only for themselves, but for others, and wear those masks as we move forward. Commissioner Clapprood is down 9. She's had 20 officers who have tested positive. 16 have come back. And you know why I say about wearing the masks? And people say, Don. Tell that to one of our officers who was on a ventilator, young man, on a ventilator, who's making some progress now. And think of your own family and friends on that. We had 34 graduates from the academy. That virtual graduation went very, very well. I'm very thankful to Focus Springfield, Pat Sullivan, putting that together. Those graduates are on the streets or in the departments. And I know Superintendent Warwick will speak of graduation aspects because we want to be able to do something and bring positive closure to our graduates. The commissioner was proactive patrols out there this weekend with Blue, State Police, to make sure that drag racing and dirt bike stuff did not occur, which we had received reports, and that went well. Commissioner Calvi from the fire department, they're down 4. Today is National Firefighters Day, so thank you to our brave and dedicated firefighters for what they do day in and day out. Always remember when everybody else is running out of that building, the firefighters and police officers are running in that building to save structures and save lives. Pat Sullivan indicated that parks were okay. We're okay. We had a beautiful weekend, so thank you, Pat. And again, with the homeless 10 aspects, I appreciate. I believe there's one individual that is down there. Pat is working on the reopening aspects, and I believe I'll have Pat, attorney, my labor and HR director, Attorney Bill Mahoney, and Helen Carlton Harris speak about that coming up. Chris Cignoli, DPW director, they're down 2. Working with Ed Pakula. Ed Pakula has the Renaissance man. He's become sort of an IT guy and running these virtual meetings, Board of Public Works and Traffic. Solid, there's no issues there. Yard waste has continued to be picked up, and the hazardous waste, I think Chris will tell you that's going to continue to go on with the vendor Saturday. Tim Sheehan, Director, my Chief Development Officer, will speak about Prime the Pump and the HUD guidelines. I'm very proud of what we've been able to accomplish there, 80-something% of this last round, and very diverse round. He'll speak about that. On the financial front, my CAFO, TJ Plant, reports to me that we have spent 5.8, deficit spent $5.8 million. $1 million of that, and I think Superintendent Warwick will speak of that, we continue to purchase laptops now for kindergarten to 2nd grade. And again, we had already made a 17,000 laptop investment a couple of years ago, but we want to be ready just in case we can't get our students back physically back into school, whether summer or the fall. So we're going to continue that. Revenue loss is upped to $2.4 million in revenue loss. And again, we're tracking any and all costs pertaining to the COVID-19 coronavirus. And as I've done with other past natural man-made disasters, I will go after every dime I can get my hands on from the federal or state government, mainly federal, for the residents, the taxpayers, and the business community of the city of Springfield. Superintendent Warwick, the meals, 17 different sites. We are now nearing, after today we'll be over it, 500,000 meals served. 478,420 meals, breakfast, lunch, snacks. And we're proud that we've been able to do that. The grading policy, we had a school committee meeting. We've adopted the pass-fail, and it really, Dan will speak about it. I mean, if you really try, you're going to be able to pass. It's virtual graduation. I'll touch upon summer school aspects to be determined. The Oasis Food Pantry, which is run by John Foley, and we get a lot of help from the Food Bank of Western Massachusetts, and I want to thank Springfield Police Department and DPW, who work in conjunction to make sure it's run smoothly out of Central High School, Smead Arena parking lots. Tad Tokar is the principal. Central, thank you. 3,500 families. 3,500 families served Friday. So we're continuing to move forward. We are happy that we're sort of seeing a trend of numbers ticking down as testing increases, but you have to be aware the more testing we do, those numbers will probably or possibly going to tick up. I'm very happy on the homeless front. Again, we took the lead before anybody else, 2 months ahead of time, and I believe now that's paying dividends. But I really would ask people to adhere Governor Baker's order now. This starts, you should have them on today or yesterday, but it starts Wednesday. Please wear those face coverings. If you're not masked, face coverings. I understand that there are masks or surgical masks available at the stores now too. And again, Commissioner Clapper and I trying to be proactive as long as I continue to have a steady supply for my first responders and soon to be returning employees to City Hall and city buildings, masks for them. The plan is being put forth. There'll be a new normalcy. You're going to see a lot of changes that occur, so you have to be patient. And when and if a vaccine is found, I think that's when people will feel completely secure. So I would assume that Governor Baker might have some announcements pertaining to business openings, maybe as early, some announcement early as this week. We will follow, because as we said from the beginning, those need to be statewide blanket announcements. And then we will follow those, and the businesses should follow those moving forward. I want to thank all the media members. You've been fantastic in getting out information for us, and I deeply appreciate that. I want to thank the residents and the business community of the city of Springfield. Though it's been very aggravating for each and every one of us, pretty much overall, you've been all very, very good about following through as we continue to starve and kill this virus. But I think we're starting to see a little light at the end of the tunnel. We just want to make sure when the open up occurs, whether it's with city functions, City Hall or other city divisions or other businesses, that it's based on health, science, and medical aspects. But I think that we are now finally starting to move in the right direction. And the last thing I'll say before I turn it over to Dr. Kerouac and Dr. Roos is that we have to show the public confidence. There needs to be public confidence, there needs to be business confidence, and then there needs to be consumer confidence. And how do you do that? You're able to do that by continuing testing, so you're able to identify any potential hotspot area. You're able to isolate, then you're able to contact trace, which we're doing. School nurses will appreciate that, and we're going to be working with Governor Baker's unit through Helen, Carlton, Harris. Community mitigation, and then being sure we work very closely with our hospitals that they have the surge capacity, and right now I think they'll tell you that they do if something was to occur. You do that, and I think without a vaccine as of yet, people will start to feel confident again. You'll see businesses going to operate a little bit differently. With this, though, gives you opportunities to think out of the box. So I think that's extremely important. So again, also to Bay State, they picked up their testing. They were, first to step up on the first responders, and they're doing at Carew Street and High Street, and they're also Brightwood, Chestnut parking lot. Our middle school appreciate that, and they're looking to stand up something in the Mason Square Health Center too. So I come to you this Monday morning with a sense of progress and hope. As I've stated before, that my team is tested and true. We've been through this a number of times, a little bit of a different animal, an invisible animal, so you sort of have a shadow boxing at times. But I think we're starting to see the light at the end of the tunnel, and that's all because of you, each and every one of you, the residents and the business community. But we have to stay ever vigilant, and please, please, wear those masks. So with that, I will turn it over, and I'm, again, deeply appreciative that every Monday morning, Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, takes the time to be here and give his report pertaining to the hospitalization type aspects. Without further ado, Dr. Mark Kerouac. Thank you.
Well, thank you, Mr. Mayor. Really appreciate your leadership during this crisis, as well as holding these forums. Appreciate working with all of your team, particularly Commissioner Carlton Harris, in terms of working out the issues with respect to the homeless testing. I also wanted to mark the fact that Wednesday begins Nurses Week. It's an annual celebration that ends on the birthday of Florence Nightingale. And it's important for all of us to remember that modern hospitals exist to provide nursing care to patients. And our nurses have been on the front lines and have made us all proud of the work that they've been doing throughout this crisis. In terms of the case numbers, we're continuing to see a steady decline. We saw our first cases in early March. On March the 29th, it was the first day that we went over 100 cases across the system. And peaked at about 179 in early April. Since then, for about 3.5 weeks, there's been a steady decline. And over the last few days, for the first time, we've come back down below 100. And so that's a big milestone for us, and we're really very pleased to see that. We've also been able to maintain low levels of ventilator use and therefore ICU care. So in addition to those 100 individuals, there are about 350 who are receiving usual care. Other diseases are not taking a vacation. People are still having heart attacks and strokes, and on the happier side, moms are still having babies. And so we continue to work as kind of two separate hospitals that are segregated and separated for the sake of safety, so that people with other illnesses can feel comfortable coming in and getting that routine care. And so I certainly would urge people who have serious symptoms that might otherwise cause you to think about coming to the hospital not to hesitate to do so before fear of COVID-19. I've taken great pains to keep folks safe, have been able to keep other patients safe since the beginning of the epidemic, including the folks who are on our team, protect them as well. And so what we have put in place to separate people and to follow preventative measures has been effective. Even though we are on this 3.5 week decline, Boston and Worcester are still at their peak, and they are still simmering along. One of the important things that the Department of Public Health statewide looks at is what is the percentage usage of ICU beds compared to where you were at before COVID ever showed up. It's important to realize that Bay State Medical Center expanded from a 720-bed hospital to an 850-bed hospital, expecting a bigger surge than the one that showed up. Right now, today, we submit data to the DPH every day in terms of how many patients are in those ICU beds requiring those ventilators, and we're down about 50%. In other words, 50% of the ICU beds that would have been available before the surge are there. But statewide, we are 14% over that limit. In other words, if not for the expansion of those beds in Boston and Worcester, we would have been having some of the terrible scenes that you saw in Italy and in Manhattan of people not being able to access medical care. So we're still concerned that there is all this activity going on just to our east, and we're very therefore conscious of maintaining social distancing and really working hard to contain hotspots. I'm working with the CEOs of all the other major systems in the state to plan for surge planning. We came close to accepting some transfers because we are seeing less than the folks in the east, but it wouldn't surprise me if we were to need to take some folks in transfer just to balance out the use of ventilators across the state. On the testing side, the mayor mentioned we are at 3, soon to be 4 sites for testing in the city. This is in addition to 3 sites in Greenfield, Westfield, and Ware. We have focused on the city because of the vulnerable populations here. It is the area we worry the most about in terms of folks catching the virus or having serious disease once they do. We also are helping other hotspots, such as the 5 skilled nursing facilities and providing resources to the Holyoke Soldiers Home. In addition to setting up the 4 sites, we are expanding the criteria for testing. You'll recall at the very beginning we only would look at inpatients and first responders as well as healthcare workers. Then we expanded to patients who actually had symptoms. Now we're going to be expanding to patients who don't have symptoms but are contacts of patients who have been tested positive. And that's an important step for us to take. I look forward to the day when anybody, any day who wants to, can walk in and get a COVID-19 test. We're not there yet, but we continue to expand day by day. We were happy to be able to work with the city in terms of the testing of the Friends of the Homeless, and appreciate Commissioner Carlton Harris's cooperation around working out those logistics, and that's an important area of vulnerable patients to be sure about. As far as PPE, we continue to chase PPE all over the country. Disposable gowns are the highlight of this week. We're doing okay. I don't want to go into all the details of that, only to say that this week we're going to begin accepting 1,500 disposable gowns a day made by a local manufacturer. We also have been exploring helping manufacturers retool their shop to make masks and to make testing materials. I think in the interest of efficiency over the years, we became more and more reliant on overseas sources of these critical items, but this is a new world and a new day, and we really need to think about local sourcing of these critical items so we won't ever have to scramble like we're doing today. And we're trying to think about that in a strategic way because these manufacturers want a longer-term commitment at a price that's somewhat higher than we used to pay, but way, way below what we're paying today on the, given the uncertainty of the market. Of course, the need for both PPE and testing materials is only going to go up as we begin to thaw out and reopen the economy, because many of the sectors feel that it's important for them to have access to these same materials. So it's going to be more important than ever for us to be able to produce large amounts of this in a way that's secure. I want to say a word about contact tracing as well, because this is one of the keys to containment. If you get tested today positive for COVID-19 and you don't do anything about it, it does no good for anybody. What's important is that you ought to isolate yourself for 14 days, but also provide information about other people you might have infected so that they can come in for testing and they can then determine if they need to be isolated. Historically, this is something for infectious disease that's been handled by the local boards of health, Commissioner Carlton Harris and her team, but the amount of work that needs to be done to do this contact tracing for COVID-19 is enormous. And so the governor has stood up a group called Partners in Health. They've hired 1,000 people across the state to do telephonic contact tracing. And they are now beginning to work in collaboration with all the boards of health, and I'm sure Commissioner Carlton Harris could give you the details of who's doing what with regard to that. But I wanted to put this message out there just in case any of you get called by somebody who wants to let you know that you might have bumped into somebody with COVID-19. Please take that call. Please take it seriously and follow the instructions in terms of getting yourself tested and, if you need to go into quarantine so you don't infect anybody else. Lastly, I wanted to say a quick word about the Reopening Advisory Board. This is a 17-member group that was appointed by Governor Baker last week. It's led by Lieutenant Governor Polito and the Secretary of the Executive Office of Housing and Economic Development, Michael Cignoli. The goal is to provide a roadmap for the governor by May the 18th with milestones for an orderly opening of the economy. According to the governor, and consistent with CDC guidelines and what many other states have done, this is going to be done in phases, in kind of little baby steps with pauses in between, and driven by data, the kind of data being how many patients are in the hospital, what percentage of testing is turning positive, et cetera. The group is widely representative of large and small businesses, different regions of the state. There are 3 from Western Mass, industry sectors, as well as the government. I'm proud to be representing healthcare providers on the group. We spent several days, including most of Saturday and Sunday, hearing from a wide variety of business groups via Zoom meetings. These including groups representing racial and ethnic minorities, associations focused on community development, as well as experts from government and public health. We're also hearing about the necessary preconditions to reopen the economy, like having adequate child care, safe mass transit, adequate PPE, and testing. Secretary Cignoli has asked that any detailed questions about the work of this group prior to the release of its report on the 18th would go through his office, and so I will be respecting that request. Finally, I wanted to thank the citizens of Springfield and Greater Springfield for your continued efforts. It's pretty clear to me that some good stuff has been happening here in Western Massachusetts that's allowed us to keep a lid on this infection in ways that folks both to our east and west have not been able to do. That still doesn't mean we can let up on our guard or relax just yet. We certainly hope that the rest of the state follows along to the path we've been on very quickly and enables us all to get back to something closer to the way we used to live. So thank you for that. I appreciate the opportunity.
Thank you, Dr. Kerouac. And thank you, Dr. Kerouac, for serving on that board. We're very appreciative and lucky to have you for Western Mass, not only on the medical front, but also you understand the business aspect of it too, so we appreciate that immensely. And again, I appreciate that Dr. Robert Ruse, from Chief Medical Officer for Mercy and Trinity Health Systems, takes the time to be here. So without further ado, Dr. Robert Ruse, and he'll give the perspective of Mercy and Trinity. Thank you.
So good morning, everyone, and thank you, Mayor, for your leadership. And I absolutely agree with you that there's great reason for hope and that we continue to want to highlight some of the positives. I also want to thank the legislative delegation in Massachusetts for the continued support, both in terms of funding, but also legislation, and always ensuring that these decisions are made through that public health lens that is so important amidst this pandemic. However, this morning, I also stand before you with a bit of a heavier heart myself, as my family unfortunately lost a wonderful woman to this terrible disease of COVID-19 this past week, right here in our community. My wife's aunt, Corinne, lived a full life and had the stories to prove it. And although that she is now at peace, and we know in a good place, that she will be missed terribly. Despite not having left the facility where she lived even once, she contracted COVID and is now no longer with us. And so it strikes me with her case that it's a reminder of thousands of others, of people that still remain incredibly vulnerable to this disease. Some of these folks we know are vulnerable because of their age or their conditions, and some of them we don't. And so, while there's great reason for hope, I believe that it also is a reminder that we must be cautious collectively. We must be mindful that the virus is still very much in our community, and we must take every step that we can to safeguard each other's health as we move forward together. That remains the focus of Mercy Medical Center over the past week. There's been great reason for hope and recovery over several weeks now. So we are cautiously optimistic that we are entering this prolonged, slow COVID phase. There will not be a post-COVID phase anytime soon, and it's important for us to ensure that we safeguard the care of all of our patients and colleagues. So we continue our daily vigilance and monitoring our situation as we've been reporting out here weekly. And this week, we actually saw an increase in hospitalizations for the first time in several weeks, over 3 days. And we also saw an increase in our critical care patients over the last 5 days, from a nadir low point of 6 now to 10 COVID patients. As of this morning, we have a total of 39 confirmed or suspected COVID patients hospitalized at Mercy Medical Center, of which 10 are in the ICU. As you'll recall, we saw our surge and peak at the beginning of April, with over 50 cases on multiple days during that first week, and then had a steady decline into the mid-30s. But with a blip up, we are concerned that if we don't continue the efforts, we could continue to see this virus impact those in many significant ways. We have now, over the last 2 days, seen that trend go back down to below 40. And overall, since the beginning of the pandemic at Mercy Medical Center, we've treated more than 200 patients with COVID. And COVID patients continue to represent a minority of the patients in our hospital. At present, that number is about 35% of patients on our medical units. And when taking into consideration all of our patients that are admitted to the hospital, it's less than 20%. That is important because even when we saw an increase of a few cases, we still had more than enough capacity, we still have more than enough testing, and we have more than adequate supplies, including personal protective equipment and ventilators. In regards to testing, we've now performed 5,435 tests with 1,687 positive and 3,627 negative. Another sign of cautious optimism is that the percentage of positive tests continues to go down. And so for the past week at Mercy Medical Center and Life Laboratories, that went down to 26%, which was our lowest week yet. We've also been monitoring our community as well. And in partnership with the City of Springfield, Healthcare for the Homeless, Friends of the Homeless, Rescue Mission, and all the work of all the staff composed therein, it was mentioned, and I want to express gratitude to all of those groups, that we began testing the homeless population here in Springfield and also in the surrounding towns, Northampton and Amherst, to name two. And as the mayor mentioned, a very low percentage of patients have tested positive thus far. In the initial 58 negative, out of all the tests that have come through Mercy to date, which is upwards of around 100, we've seen one positive test result, putting that rate at a little bit over 1%. That's all very positive news. And in the past week, we've also seen some of our emergency department volume go up, as well as in the hospital, which is a positive sign, I think, that patients are starting to realize the importance of seeking emergent care and no longer delaying care that could be life-threatening or critical. I still do have some concern there. We still are focusing on that effort tremendously. There are many patients for whom care, evaluation, or treatment could be vital to their health, and fears around COVID might be preventing them from seeking it. Today, I'd like to spend a little time talking with you about some of the safeguards that we are putting in place so that both patients and providers can be assured that the risk of transmission in a facility would be virtually non-existent, and that our environment is one of safety and healing. First, at Mercy Medical Center, we have established what we're calling COVID-free zones, including separate entrance, separate walkways, separate elevators, to ensure that we keep the populations of confirmed and suspected cases of COVID very distinct from those that are not. These areas are marked clearly with signage like this: and they're only able to be accessed if someone has passed a screening. We have a COVID-free operating room and an entire medical floor, our 5th floor, where there are no COVID patients, and all of our areas are geographically separated. Secondly, we've implemented an enhanced screening for all the individuals in facilities. So that includes both a temperature check as well as additional screening questions about an expanded array of symptoms as well as any potential close contacts or the history of a COVID test in the past. Third, we are requiring that all individuals in our facilities wear a mask at all times to protect each other. As we've reviewed before, my mask protects you and your mask protects me. Fourth, and this is a point that cannot be underscored, is that we have been implementing since the beginning vigorous cleaning protocols that exceed the CDC guidelines, and including the frequent cleaning of all rooms and high-touch areas, including doorknobs, desks, etc. And fifth, we are testing all patients for COVID prior to any surgical procedures and for care in other inpatient areas, including women that come in labor. This is to ensure the safety of the people that are receiving care in our hospital, because there's many individuals who may not have any symptoms but could be harboring the infection. Safety is our top priority. At Trinity Health, it's a core value. And in medicine, it's a defining principle that we must first do no harm. So I would implore us all to continue to place that at the forefront of everything that we do. And as we begin to think as a society about reopening certain aspects, I personally am grateful that we have a stellar and expert representative such as Dr. Kerouac on the Governor's Advisory Task Force, representing not only the interests and the perspectives of infectious disease, public health, and medicine, but also the uniqueness, potentially, of what's occurring here in our region. And lastly, as mentioned, this week is the beginning of Nurses Week, a week where we celebrate our clinical providers, our nurses, on the front lines and throughout our facilities, taking care of patients every day. I also happen to be a son of a nurse. And so I wish my mother both a happy Mother's Day and a happy Nurses Week. With all the I want to express gratitude to all of our nurses at Mercy Medical Center and its affiliates who have been taking great care of every patient with COVID or not, with a compassion and a healing spirit. Our providers are here, they are ready, and they are prepared to take care of all of your needs. We have the beds, we have the expertise, we have the testing and the supplies to provide safe care to everybody. So please continue to do your part as we think about the vulnerable, to keep yourself, your family, and our entire community safe and healthy this week. Thank you.
Thank you, Dr. Roos. As Dr. Roos had indicated with Nurses Day coming up, boy, he or she right on the front line, helping people recover and maybe marching out of Bay State with the Rocky theme, but also been there when people have passed. And you mentioned your aunt. I lost a cousin, Andrea Donardo, great guy. They're always caring and help anybody out. And the COVID-19 coronavirus got to him, and God rest his soul, and sympathies to the family. Next, I'm going to bring up the Commissioner of Health and Human Services, Helen Carlton Harris, who has been very vigilant on any and all of my meetings, also meetings we do weekly with the city councilors. And she had an interesting statistic that she said last week. The average age for the person who catches this, and it sort of caught me a little by surprise, 54 years old, 54 years old. So, without further ado, and she's done yeoman work, the eloquent and elegant Commissioner of Health and Human Services, Helen Carlton Harris.
Thank you, Mayor. Let me begin my remarks by expressing my condolences to the family of Paris Howard. Paris Howard was a longtime member of the city's Public Health Council. Paris Howard served for over 10 years, and it did not matter if he felt well or not. The health of the residents of the city of Springfield were his primary concern. We lost him last week. Paris Howard will be missed. I want to begin with just a little data. Some you have heard. The statewide data for positives is 68,087. That is the number of positives statewide. Here in Hampden County, it's 4,066, and in the city of Springfield, as the mayor has indicated, it is 1,484. That is 36.5% of the positives that we have recorded in Hampden County. It is important to acknowledge that the information that we provide to you on a weekly basis, we also provide a map to back up our data. This is the map for this week, and as you can see, we continue to see along this corridor, which is those zip codes that I report to you every week, 01103, 4, 5, 7, 9, and 8. And so those red dots really imply those areas that you see that tend to be thick as far as the dots are concerned. However, it is important to acknowledge when we first started this journey with this map, these areas in the less dense parts of the city had very few red dots. What we know is that community spread is happening. And so it is important to acknowledge while we see the higher cases or positives in the dense areas, we also know that the outlying areas are also experiencing COVID positive. I also want to point your attention to April 6th. I told you that there were 171 dots on this map. Today, I'm telling you there are 926. Remember, this is unique locations. These are 926 unique locations where we have recorded a positive, COVID-positive 19 case in the city of Springfield. In 1 month, we have seen 755 locations added to this map, which tells you that in the month of April, it really has, from a data perspective, we've seen the locations increase. I am so proud to live in Western Massachusetts. We have the most amazing healthcare providers and systems anywhere in the Commonwealth of Massachusetts, or I dare say, in the state and country. Mercy Medical Center, Bay State Health, when we said, we need your help, we recognize there was no community health center that was located in Western Massachusetts that was targeted for testing. And so we went to those two providers and asked them to assist the city of Springfield in assuring, particularly that our homeless populations were tested, whether they were asymptomatic or symptomatic. Both of those health systems stood up and got the job done and continue to do that. We are enormously, yes. We are enormously proud to partner with organizations who understand the populations in the Western region and step up. So I cannot thank those two health systems enough for what they've done. And I am so proud to be the commissioner in the city of Springfield and to work with amazing partners. We will be instituting a Board of Health regulation. As of May 6th, the Commonwealth of Massachusetts is requiring you to wear face coverings in public settings. The coverings help prevent the spread of COVID-19 and are really a part of the path to reopening the city of Springfield and the Commonwealth of Massachusetts. The city of Springfield did recommend face coverings and really was one of the first cities to do that in the Commonwealth. We did not make it a mandatory recommendation based on our concern about enforcement. However, it is mandatory and will be mandatory as of May 6th. In general, you should wear face coverings when you come within 6 feet of an individual based on the governor's recommendation. And so, in general, this will include shopping in a store, picking up food at a restaurant, waiting for or riding on public transportation, riding in a taxi or other service vehicles, seeking health care, going into essential facilities that are open, working an essential job that requires you to interact with the public. When are they not required? At home? Swimming, walking, hiking, biking, or running by yourself or with a family member or someone who lives in your household. You should have a face covering, however, with you in the event you should come within 6 feet of those individuals. For those residents with a health condition who cannot wear masks, we certainly understand. I think you know that it is important to wear a face covering, and we're calling them face coverings, and because you can use a bandana, you can use scarves, you can use things that you have at home. Many individuals have gotten so creative with face coverings, and they are absolutely amazing. But we ask you to wear a face covering. Businesses must require their employees, contractors, owners, and volunteers to wear a face covering at the workplace and when performing work off-site. You should inform your customers about the need to wear a face covering, including posting signs at your stores in English and in Spanish at a minimum. Enforcement. Everyone should want to protect each other by wearing a face covering. We can't expect law enforcement or public health officials to make sure every person is wearing a face covering. But if you don't wear one, there is in the governor's order the opportunity to be cited. That is not what we want to do. Police, health officials really have very important work to do. We do not want to become the face covering police. You have heard when you wear a face covering, it protects you from spreading your germs to someone else. And so care enough about each other to protect each other. That's what we're asking. We know that the average age that an individual dies is 82. We also know that 59% of the individuals who have died have been in long-term care facilities. But what we also know is there is a lot of community spread where individuals will continue to infect each other. Please wear a face covering. We will talk more about that. There is an initiative to try and hand out face coverings to the degree we can and that the supply is there. However, care enough about yourself, your family, and who you are to protect yourself. We ask you. We also are working on the reopening of businesses, particularly City Hall. I am working with two of my amazing cabinet members, Bill Mahoney from HR and Patrick Sullivan. They are so skilled at facilities and HR, and we'll work together to make sure that the facility itself is considered, that the policies are considered, that as well we are considering public health. I also want to wish the nurses in my department and around the Western region and the Commonwealth Happy Nurses Week. What you do, you know, the angels of mercy that you are also always heading in when other individuals are heading out. And this has been highlighted during this COVID-19 challenge virus that we're facing. You are heading in. You're taking care of the patients. You're taking care of each other. You're taking care of your families. You're taking care of your mental health, your physical health. I so value and appreciate you. Thank you very much. Thank you. I've said it before, let me say it again. Springfield Department of Health and Human Services staff, thank you. Thank you, Springfield Public School nurses. You helped us before the governor's CTC, Contact Tracing Collaborative, came on board. You were in the front lines helping the city of Springfield, and together we contact traced over 700 individuals. Amazing work that you've done. As the mayor said, we will partner with the Commonwealth based on the numbers when we feel it's appropriate to help us with contact tracing. Also, those of you who reached out beyond the walls of City Hall to do work in the community, some have been publicized, others have not. I would appreciate it if you would send me your name of your organization or your name, the work you've done, so we can highlight you on our website as well. You have heard from individuals who have donated masks. We know people are out there with food. The Department of Elder Affairs for the City of Springfield continues to go out there and provide food to our seniors. They are so appreciated as well. Please let us celebrate you, because it's only because of you getting out beyond the walls of City Hall that we are able to do the work that we do, and we are very appreciative. Cornell West writes, "None of us alone can save the nation or the world, but each of us can make a positive difference if we commit ourselves to do so." That's what we're asking, to continue the strategies you put in place. And Springfield, I have to tell you, I am so proud of you. You are doing what's necessary to contain, and we want to keep that work up. Do not let the fact that we have some good news deter you from doing the things that you have already done. The social distancing, the hand hygiene, staying home if you are sick, taking good care of each other. And I continue to ask you, if there's someone in your neighborhood that you know needs some support, please call them, pick up the phone, ask them if you can help. Maybe you go grocery shopping for an elder. Maybe you help someone as far as a child who might need some support is concerned. Remember, health is physical, mental, spiritual, and emotional. Contact tracing is critical, and I think Dr. Kerouac did a nice job of helping us to understand the importance of contact tracing. I, too, am very proud that Dr. Mark Kerouac will represent us on the governor's task force. We could have no finer voice than Mark Kerouac, and no finer individual who is well-versed and understands the issues of urban communities, vulnerable populations, and so it makes me very comfortable that he knows who we are and that he will be there. Stay home, stay safe, stay strong. Thank you.
Thank you, Helen, very, very much. And again, she echoed self-responsibility. So wear that face covering. Wear that face covering. I know when I take my walks around the neighborhood yesterday, the face mask is on. Or if I go into a CVS or Walgreens, a face mask is on. The trend seems to be good, but we can't take our foot off the pedal, and we have to stay ever vigilant moving forward. Speaking of staying ever vigilant, our public safety sector under the police command of Commissioner Cheryl Clapprood and Fire Commissioner B.J. Calvi, the rank and file, everyone has done a tremendous job. They're out there night and day. They have enough challenges to deal with, let alone COVID-19 or coronavirus. And they have had firefighters and police officers who have come down with this virus, with one fighting strongly off a ventilator to get back. So that's where the self-responsibility comes in. So with our public safety update, without further ado, Springfield Police Commissioner Cheryl Clapprood.
Thank you, Mayor. Good morning.
Good morning.
As the mayor mentioned, I'm down 9 positions as of today, and those are because of the COVID illness. Total, I had 20 positive tests, and 16 officers are returned to work after testing positive. I do, as the mayor mentioned, have 1 officer still hospitalized. He went back and forth between stable and critical, and I got some happy news today that his nurses report that he is stable and he is doing better every day. So I am very thankful for He is a young man in his early 50s. He was in good shape, and he kind of took us by surprise. But I guess that just goes to show you how vigilant we all still have to stay. I also have 1 officer who was in a cruiser accident. He fractured his jaw in 2 places. He was in the hospital for quite a while. He's released now, and after surgery, he's going to take some time to recover. We're probably going to miss him for about 6 months. So we've been dealing with those issues. We had plenty of extra patrols this weekend. I knew it was going to be a nice weekend. I knew people would want to get out under the circumstances, so the game plan was have as many officers out and about and visible as I could and stop things before they got started. Call volume was very high, but incidents, as far as being bad incidents, was kept to a minimal, and the officers did a great job, and I thank them. Every day, these officers, they know the risks they're taking. They come out and they do their jobs, and they did a good job this weekend. I'd also like to tell you that one of the highest calls that we're receiving lately are calls for mental health issues. So the police department did partner up with BHN, Bay State Health Network. I have 2 workers who are Monday through Friday. One is days and one is evenings. They call themselves on the radio BHN1 and BHN2. And they are probably the 2 busiest people last week. Their help is really appreciated. We take extra caution and extra patience with these calls. I know people are pretty frustrated. I know people are isolated from maybe family, friends, support networks and groups to help them out. So we're trying to do our best with those type of calls. I do support the mayor's idea, and I am behind the idea of having officers have surgical masks or face coverings. When this enforcement starts, I think it would be great for officers to first explain why it's important that people wear face coverings. If you're not able to get a face covering, I think it would be important for us to offer you one first and gain compliance before any necessary enforcement is necessary. So we'll see how many of those masks I can get into the hands of some of the officers on the street. Today and yesterday, we had 34 new officers who started. They graduated Thursday. They are split up into groups of 4 or 6 officers. They're in different billets throughout the station. They will stay in different areas for 3 weeks at a time and then rotate, and then finish that up in early September and then go where they belong as far as seniority goes. So I'd also like to thank the public, and people have been great, feeding us lunches, dinners, and even making sure they hit the midnight to 8 group, coming in, still donating face covers and materials that we need. Everybody's been wonderful, and I know on behalf of the police department, we appreciate it very much. Thank you.
Thank you, Commissioner Clapper. Now representing the Springfield Fire Department, Springfield Fire Commissioner Bernard B.J. Calvi.
Good morning, everybody. Good morning, Mayor. Thank you. And happy birthday again.
Thank you.
At the fire department, we still have 4 members that are out. Only 2 of those members are positive. We expect the 2 of them to come back this week, so we'll still only be down 2. The department has been out there 24/7, 365. We've participated in several community parades to show our support for young children, and over at the hospitals for the nurses. So we're happy to take part in all those and still be involved in the community in these trying and difficult times. As the mayor said, today is National Firefighters Day, a celebration of firefighters around the nation. I've got a little quote I want to read. This was written by Chief Edward Croker of the Fire Department in New York 120 years ago, and it still rings as true today as it did back then. I have no ambition in this world but one, and that is to be a fireman. The position, by many in the eyes, may appear to be lowly, but we who know the work which the fireman has to do believe that this is an honorable calling. Our proudest moment is to save lives. Under the impulse of such thoughts, the nobility of the occupation thrills us and stimulates us to deeds of daring, even of supreme sacrifice. So, no one ever wants to lose their life doing this job, but it's often something that we have to do. On this National Firefighters Day, I'd like everybody to remember those who have paid the ultimate sacrifice and say a small prayer for them. The teamwork at the Springfield Fire Department is outstanding. We're getting through this together, and thank you to all the team members at the fire department. No matter what your rank, you're all doing your part to make sure we get through this together. Thank you very much. Everybody, see you next week.
Thank you, Commissioner Calvi. And by the way, they're still fighting fires. They had a couple of fires, I think 2, definitely 2 this weekend that they had to knock down very quickly. Superintendent Dan Warwick is here. He and his team have done a great job with our school committee. We met a couple times last week via Zoom, and the teachers have done a tremendous job. So Superintendent Warwick will give you an update pertaining to our school system. Superintendent Dan Warwick, Springfield Public Schools.
Thank you, Mayor. I just wanted to start off by thanking the mayor. We made a tremendous effort about 5 years ago to purchase laptops for our students, and we had gone 1-to-1 in grades 3 to 12, but only 2-to-1 in grades K to 2. When we started to send them home, we were running short. The mayor stepped up this week in spite of the budget challenges facing the city of Springfield. That's why we call him the education mayor, and supported us in purchasing K to 2 laptops for all of our kids. So again, we've moved them out. We took a chance and distributed them, but the mayor stepped forward and helped us out with that. As the mayor said earlier, this week, by midweek, we'll be up to distributing almost 500,000 meals from our schools. breakfast, lunch, dinner, and a snack, and again, providing on Fridays for the weekend. And we had a huge turnout Friday for the weekend. Last Thursday at the school committee meeting, we talked to the school committee about graduation activities. This is a rite of passage for our students and their families, and we're trying to plan appropriate activities to deal with graduation in light of the current crisis that we're facing. So we're planning a virtual graduation, and then also planning with our principals for appropriate activities in August, so that hopefully our seniors can get together again for some of those activities. We'll be putting more information out on that. Thursday, we also passed a grading policy, a credit, no credit grading policy for our students for fourth quarter, and a calculation for their final grades. Again, very important. We're going to have information out to all of our families. It's on our website, so that students know exactly what they need to do, and their families know exactly what they need to do to achieve credit for this fourth quarter. And as the mayor said, it's putting effort forth and engaging in the work. So it's very reasonable, and I was thrilled with the policy. We also upgraded our remote learning plan. Now that we're out for the rest of the year, it was important that we went more deeply and pushed forward our learning plan, covering some new material as well for our students. Talking about summer learning, and it's coming upon us, planning a summer program. Every year we run an extensive, and each year we've increased it, summer learning program, of course live and in the schools. I have my staff now planning 2 programs. One, if we can hold a live program, again working with our health commissioner to make sure everyone's safe, we're going to attempt to do that. But if we can't, we're also planning a virtual program so our kids will have something over the summer months, because they've had significant, we missed a third of the school year already. So we're working on that. Again, very, very proud of my staff. They've just done a great job reaching out to our students and their families, trying to keep the learning going, and it's a significant effort. Thank you. Thank you, Mayor.
Thank you, Superintendent Warren. Thank you, Superintendent Warren. Thanks, Stan. On the DPW perspective, Chris Cignoli, Director Cignoli, will come up and give you an update again. His men and women are out there, and your trash is getting picked up, your yard waste is getting picked up, road work is continuing, and I'm very, very thankful. I think sometimes you might forget that DPW is out there. So without further ado, the Director of Public Works, Chris Cignoli.
Thank you, Mayor. As the mayor said, I'm very thankful to my employees. They are all chomping at the bit to even do more with regard to construction as we move on. This week, a few items, working with Eddie Pakula in the Law Department to be able to set up our Board of Public Works and our Traffic Commission meetings to allow some of the bigger projects by our utility partners to be able to move forward. As the mayor mentioned, solid waste, recycling yard waste has been going well. One item of note, we are still inspecting barrels and materials, so please make sure when you're placing materials in your barrels, they are the correct materials. We do have 2 employees out. Neither one are positive. They have family members who are, and they will be back next week. Construction activities throughout the city are ongoing. All of our major projects, as a matter of fact, 3 major projects are out to bid right now. Central Street, we will be starting at Bay and Berkshire in the next couple weeks with Mass DOT, and our annual paving program will be moving on. One other item, this Saturday, we will be having our household hazardous waste days. If residents have materials they need to get rid of, please contact 311. We usually service about 200 residents when we do that. Right now we have about 100, so there are openings for everybody at this point. It is a vendor who handles this for us, and it is done down on Grockmall Street, and there is virtually no interaction. You pull in, you'll open your trunk, they will take the materials out for you. So if you have household hazardous materials you need to get rid of, it will be on this Saturday. So please call this week and make an appointment. Thank you.
Thank you, Director Cignoli. Chief Development Officer Tim Sheehan is here. He and his team have done a tremendous job. Again, I believe we were the first in Western Mass and one of the first in the state to literally put out $750,000 to help our front line, whether restaurants, small businesses, mom and pops, to continue to prime the pump and give them a shot in the arm to be ready to go when we phase in our reopenings. So Timmy will give you an update on that, and without further ado, Chief Development Officer, City of Springfield, Tim Sheehan.
Thank you, Mayor. The Office of Planning and Economic Development has now reviewed and scored over 202 applications through both grant rounds, 86 restaurant grant applications, and 116 small business grant applications. Of the 89 eligible applications in the small business round, 85% were funded to some degree. We're very pleased with the ethnic and geographic diversity of the awards that were announced last Tuesday. As we indicated in both the press conferences related to the grant and the application, the focus of this program was on keeping people working to the degree possible under the emergency public health orders. Thus, if a business was closed and laid off their employees, they were not eligible for the grant. That is not to say, however, that these businesses are not important to our local economy. The HUD funding source that we were using and the national objective associated with it, however, was the retention or creation of a low and moderate income job. Therefore, any recipient of the funding had to evidence back to us that they had an employee that met that criteria. As we advance forward, looking to reopening businesses, we are hopeful that we'll be able to assist those businesses that have yet to benefit from the program, as well as the nonprofit sector of our economy, which also has had significant economic losses. 106 grants totaling roughly $750,000 have been advanced to contract, with most in the first round having executed contracts and received their first grant payment. It should be noted that the city's policy for contracts related to financial incentives requires the review of the grantee standing with the city regarding taxes, health code, and code enforcement. Additionally, HUD's public benefit standards under 24 CFR 570-209 precludes the city from providing assistance to any business entity that is subject to unresolved findings of noncompliance related to any previous CDBG assistance provided to that applicant. Finally, there were some questions as to why the two franchise establishments were awarded funding. The program did allow for locally owned franchise establishments to apply. The two awarded are locally owned, and they're combined they have 30 employees, 25 of which are residents of the city of Springfield. Beginning this week, we will be starting the 5-day public comment period on the CDBG-CV CARES Act funds, with the hopes of advancing the action plan early next week to HUD for final approval. Thank you.
Thank you, Director Sheehan. Thank you for that clarification, too. If we are able, if I'm able or we're able to get my hands on another pot of money, whether here locally or state or federal, Director Sheehan, the next move would be having businesses reopen the new way that they have to reopen. That's the way we would work with them to be innovative. And I'm hopeful, again, if we can find some money on a local side, we'll do that. But I am hopeful, whether on the federal level or state, again, on the federal level, they just can print up money. The state and I have to make sure we balance our budgets. I thank Director Sheehan for clarifying the very specific HUD regulations. Very proud of how fair we were and how these grants were spread out across the city, touching all types of businesses and ethnic groups. It is not fair for someone to lose out on a grant when they followed all the requirements and met all those requirements, when others might say, well, this business should get it even though they were not following the requirements, which are doled out by HUD and not meeting what is needed to be met under city and HUD guidelines. So we want to clarify that. We want to clarify that. Now I'd like to move to Pat Sullivan, Director Sullivan, Parks and Facilities Management, and he will start to highlight some of the moves that we're going to make as we start to do a phased-in reopening of city facilities, and hopefully in the very, very near future. And he's working very closely on the HR labor front with Attorney Bill Mahoney. And obviously, anything we do has to be based on health, science, and medical, and working very closely with Health and Human Services Commissioner Helen Carlton here. So I'm going to bring Pat up. He'll give the update of his divisions, but start to give you a little update on the reopening, and then Bill Mahoney, Attorney Mahoney, and Helen Carlton Harris might chime in on that too. Pat Sullivan.
Thank you, Mayor. Good morning, everyone. First, I'd like to thank our frontline custodial, tradesmen, and park employees. They're doing the necessary work to keep us all safe with repairs and maintenance and cleaning. I also want to thank the residents of Springfield and the surrounding areas. I saw some news clips both on both news outlets this weekend, and I was very happy to see everyone safe social distance. I'm very grateful to Commissioner Clapproot and Sheriff Nick Cochee. They're providing our patrols in the park. But what you're doing as residents and visitors to the parks and following the guidelines is keeping us all safe and allowing these resources to stay open. The eastern part of the state sounds like they're having issues in their parks. They actually had to close a couple down, maybe for problems or just for overcrowding. So thank you all for your continued cooperation. As the mayor indicated, he is getting anxious to reopen, but we are waiting for the governor's announcement on that. But he approved draft plans prepared by myself, Helen, and Bill Mahoney last week. And we're following the CDC guidelines for that are being given to us for opening our country. We will wait for the governor's directives, but we know there's some common sense things that we all need to do. So for example, in City Hall, you will be greeted as you approach the door. Your temperature will be taken. Probably for phase one, we are going to request that you contact the appropriate department and schedule an appointment. That hopefully can be relaxed when we enter phase two, and I think that's an important thing to realize. This will not be a switch goes off and we just go back to business as normal. That it will be a very slow opening, and it will go through 3 phases. And the third phase, if all goes well, might not happen until August or September. How this virus is responding in our community, how we are responding and being careful will dictate how long each phase will take. After your temperature is taken and you have been given clearance to enter the building, you will see that there will be directional arrows. For example, in City Hall, there will be a one-way flow through City Hall. The back staircase will be up, the front staircase will be to leave the building. If you're with a guest entering the building or a family member, 2 people will go in the elevator. If you're by yourself, then there will only be 1 person per elevator. Again, we have to continue our safe social distance guidelines. The building will be cleaned on an hourly basis by our custodial staff in these public areas. We will have plexiglass screens at the counters to keep both you and the employees safe. And as we go through this, we will just continue to make these updates. We hope to have these guidance completed within the next week, and they will be all announced in hard copy once the governor announces his next steps on May 18th. So we appreciate your continued cooperation, and we'll keep you updated as we move forward. Thank you.
Thanks, John. Thank you, Director Sullivan, AKA the Wizard of Oz. We'll be much more specific when we roll out the announcement. You will be having to wear a mask to come into City Hall, and we're going to make sure that all our employees have the proper protection also. But as Director Sullivan indicated, appointments are going to probably have to be made as we readjust in the first phase and how we interact. A lot of this obviously awaits, and we're again very thankful that Dr. Kerouac serves on that transition opening committee. Governor Baker's edict. I think maybe you might see some things maybe coming out this week that are possibly, but then by the 18th you should have the full recommendation moving forward. So we'll await the business, but we are chomping at the bit, and we miss our public. We want to see you, but we want to do it. We want to do it smart. I'm going to bring up Attorney Bill Mahoney, my HR Director and Labor Director, just to say a little bit about perspective of the personnel aspect. Then if Helen would like, again, just to come up to say a few words, but we'll be very specific when we roll out the major reopening plan. Attorney, HR Director and Labor Director, Attorney Bill Mahoney. Bill?
Morning, everybody. I just want to start off by saying congratulations to our firefighters on National Firefighters Day. They do an excellent job for the city, and we're very proud of the work they do for us. And also want to commend our nurses on National Nurses Week. We have about 65 school and community health nurses, and they do a tremendous work for us as well. Opening businesses or public government back up is more complicated than closing it. So we've been working very closely as we start to put together a methodical plan in order to get this done and get it done the right way. One of our biggest concerns, of course, is making sure that our employees are healthy and safe when they come to work every day. So we'll be taking some steps, and for those of us who are in this building every day, we already see it. My temperature is taken first thing in the morning as soon as I show up at the door, as is the mayor and as is everyone else who comes in through the back door of City Hall. That will continue with our employees, and if anyone has a temperature at 100.4 degrees Fahrenheit or higher, they'll be told they need to go home. They won't be able to enter the building. They'll be told to contact their doctor or their healthcare provider, and to contact the health department as well. That is one of the precautions we'll be taking, as well as a number of others, in order to make sure that our employees, again, are healthy and safe when they come to work. Pat talked about some of the precautions that'll be taken, between plexiglass shields we've put up in the building, the daily cleaning and sanitizing of the building, disinfecting of the building. All of these things are going to be done to protect both the public and our employees. We have a series of symptoms that we are aware of through the CDC, and we will communicate that with our employees. If they're suffering any of those symptoms, again, they'll be told please not to come to work. When you report to a work location, as Pat was talking about, you're going to see different ingress and egress in the building, different hallways you'll be using, stairwells, limitations on elevator use, things in order to keep our staff separate, again, from each other and from members of the public, and keep members of the public separate from our staff, so that people are maintaining that safe social distance, and we're taking those necessary steps. Finally, we'll be looking at how we're going to phase in our work schedules, whether we do this in a team environment and having multiple teams in each department, or in another way. And we'll be talking with our department heads to see what works best for them. Thank you. Please stay safe.
Thank you, Attorney Mahoney. And last thing Bill had said too, about the staggered workforce. So you're going to see, especially in the first phase, a combination of people physically here, staggered schedules, some that will continue to work remotely, or staggered schedules on days, because as Attorney Mahoney indicated, and Commissioner Helen Carlton Harris, I think, will indicate, you don't want to, and what Commissioner Clapprood and Commissioner Calvi have already done, being paramilitary, they have separated Cheryl in 5 different headquarter areas and command staff, and as with Commissioner Calvi, locking down the departments at separation, so that we have a path of leadership that continues. Same thing with our internal departments. That's key. Helen will touch a little bit more on the health, science, and medical of our very hopeful, shortly staggered phased-in reopening.
Thank you, Mayor. We do continue to work with Patrick Sullivan and Bill Mahoney and all of the members of the Mayor's Cabinet. Obviously, the goal for us from a public health perspective is to keep our workforce healthy. We will be asking each department within city government to make sure that they are looking at their environment as well, and thinking about the CDC guidance and the guidance that will be distributed by Patrick Sullivan and the Personnel Department. We need to make sure that no one has a sign or a fever or has a temperature over 100.3 degrees. We also are going to ask individuals that we know that temperature is only one of the criteria as far as COVID-19 is concerned. So we will be asking individuals to monitor also their breathing and other signs associated with COVID-19 24 hours before coming to work. We'll also ask our employees to make sure if they're living in a household with a person who has tested positive, if they're caring for a person who has tested positive, if they've been within 6 feet of an individual who has tested positive for COVID-19 for more than 15 minutes, that they are absolutely making sure that they are well and before coming into the workplace. This is going to take a coordinated effort. We will use the CDC's guidelines, but we will also ask our employees, please, to make sure you are protecting yourselves, and we're going to ask the public, understand that we want to protect you as well, and we want to make sure that you are taking the precautions so that you protect yourselves from us as well. Again, we're all in this together. We want to make sure that no one in your family or in your circle has been asked to self-quarantine or isolate themselves based on a COVID-19 positive. We are working closely around procedures to return to work. We will be using the guidelines set out by the CDC. We will be working together. We thank the mayor for his vigilance and his putting us in a place where we can begin the mitigation process around opening up City Hall and city departments. We will have a more concrete plan that we will come to you with that will be circulated widely. We will be meeting with some department heads who are off city sites so that we can talk to you about your buildings, about the public health restrictions, and what you need to do in order to keep your employees and the public safe. So understand that our plan is not final, although we do have the bones concretely in place. We will make sure that we are communicating to department heads, which is important to say. Department heads, you're going to be critical to our reopening plan, but we will communicate concretely and extremely timely. Thank you.
Thank you, Helen. Thank you, Commissioner Helen Carlton Harris. And again, and I know Dr. Kerouac will carry that on with Governor Baker's review committee, we have to hit 3 things for our public. Public confidence, business confidence, and we have to make sure that there's consumer confidence. And that's the way we do it as we start to phase in our reopenings. I know my solicitor, Ed Pakula, is here. I don't know if he has any legal updates. I think he's all set, and I gave the financial update with my CFO, TJ Plan, and if TJ has anything, he's all set on that. So with that, I appreciate your patience, as I've done in the past press conferences. I would ask any questions, first questions, be directed to Dr. Kerouac and Dr. Roos. I'm so appreciative that they take the time every Monday morning to be here, and they've only been a phone call away for myself and the city so they can get back to Bay State and Mercy. So if there's any questions for this President, CEO, Bay State Health Systems, and the Chief Medical Officer of Mercy Trinity Health Systems, please, they would be first. Audrey, you did a nice job anchoring the other night, too. Good job.
My first question is for Dr. Kerouac. Given that your new role on the reopening committee within the state, I wanted to ask just, it's been said by the governor a bunch of times that he's going to be working in lockstep with the other nearby states. Given what New Hampshire announced in Connecticut, that they have plans to reopen golf courses, salons, barber shops within the next 10 days of New Hampshire state's by the 20th of Connecticut's case, is that something that we're going to be seeing in a similar fashion, similar types of businesses reopening?
Yeah. I'm not really going to comment on what businesses may or may not reopen in terms of the recommendations of the committee, but you're correct that the governor has agreed to coordinate with the other leaders of 7, I believe there were 7 in all states that have tried to coordinate things, which doesn't mean that they're going to happen exactly at the same time, of course. And, you know, many of these things are being considered by the group, and the governor may choose to do some things before the recommendations are final, or he may wait until the final recommendations are written.
And I have one other question too, based on something you said earlier, and I know you mentioned this before, that you give the support for the Holy Soldiers Home. I was wondering, because of the, I guess, the lack of surge that you guys have seen in the reduction in the ICU beds and limited meeting and many, have you guys been moving medical equipment to the Holy Soldiers Home? Like, what sort of support have you guys given that?
We've not sent medical equipment, we've sent personnel, we've provided expertise. They've actually had stores of, or the ability to test and the personal protective equipment. What they really asked us for has been protocols, procedures, et cetera. There have also been several so-called PPE coaches. These are people who watch the workers put on and take off the protective equipment to make sure they don't contaminate themselves. So we've really tried to furnish what they wanted. The Soldiers' Home is really not in a position to do ventilator management, and so, and I believe the majority of the patients there who passed away had voiced advance directives not to receive a ventilator if they were to get very sick.
Any other questions of Dr. Caraway? Paul?
At some point, elective procedures are going to resume at your hospital. Given the difficulty that you had convincing people with urgent conditions to come to the hospital, how are you going to give people confidence to return for their annual checkups, colonoscopies, things like that?
Yeah, I think that there is, it's an excellent question, Paul. There's a burden on us to communicate with people, how will we keep them safe? And I think that's going to be true for every sector of the economy as well. Certainly when they've opened up Wuhan, China, it's not like everyone flocked back to the restaurants or the movie theaters or whatever. People need to feel confident that they are going to be protected when they come in, and we are going to be crafting messages. Effectively, we're already doing that, and as I say, the majority of the patients by far in our hospitals are those receiving routine care, but I think we do have a burden of communicating this in a very formal way.
And Dr. Bruce described it, Mercy, separate entrances, open free zones, things like that. Is that going to be something we're going to see permanently at your hospitals as well as at the ones that Trinity runs?
Yeah, those exist today at Bay State in terms of, and I think that we are likely to be dealing with COVID positive patients for maybe for years. And that, like other infectious diseases like the flu or measles or tuberculosis, we're going to need to have areas of the hospital where we can safely care for patients who have an infectious disease. That is nothing new.
Dr. Roos?
So just essentially to reiterate both the points, I really think that in order to ensure that the patients and families feel confident coming to the facilities, we'll continue to demonstrate the safety and the effectiveness of the care that we have, and ensure that people know the great lengths that we are going to ensure that we have mitigated or completely eliminated any risk of transmission of the virus, and keeping them safe. We expect that this is going to go on for quite some time. So this is months, this could be years, this could be really a new normal way of operating where we have different entrances, different elevators, different units. We will do whatever it takes to keep the patients and the staff safe.
Any other, Audrey? Go ahead. Audrey Russo.
We do have a protocol for the use of remdesivir. The FDA has also released it on emergency use authorization, which would mean that even a hospital without a protocol could apply to use it in an individual case.
And so do you guys have it, or would you recommend it?
I don't know if if we have it or if we've used it at this moment.
And I just would comment. So until May 1st, when it was granted emergency use authorization, it required the participation in clinical trials. And so, Mercy, we had not utilized remdesivir, and we're just exploring opportunities to either participate in clinical trials, and now we'll explore the emergency use. In regards to other treatments, we've talked at some point about the use of convalescent plasma, for which Trinity is engaged in a clinical trial to evaluate that effectiveness, and the early reports are showing some signs of promise. So there have been, as of last count several days ago, at least 19 patients that had received convalescent plasma within the region, both the Connecticut and Massachusetts hospitals, including several patients at Mercy Medical Center. And while it's certainly not for publication, the results of the study, early indications are good.
Any other questions of Dr. Caraway, Dr. Lewis? Paul Tuthill. That's all right, you go.
Oh, my question was about the results we're seeing in the test of the homeless population. Very few positive cases in Western Massachusetts versus, I think they were reporting about 50 to 60% of asymptomatic in Eastern Massachusetts.
So I think it was 30. Yeah. So there was a CDC report that came out looking at the testing of homeless populations in 3 different cities. It actually included Seattle, San Francisco, and in Boston. And in Boston, the rate of testing that population, the total positive percentage rate, I believe, was about 35%, of which a large percentage, maybe upwards of over 80% of those that tested positive were asymptomatic. Now, those were in areas that had had outbreaks. There was other studies done where there were testing of homeless populations where there had been really no confirmed clusters of any infections. And I believe it was also in Seattle, and that rate of testing the homeless population was at about 5%. What we're seeing here in Western Massachusetts, just with the early results, is it's even below that we could be even below 2% or maybe even closer to 1, which I think is really remarkable in terms of the extent of the efforts that have been put in to both educate and put in social mitigation policies like the wearing of masks, the reinforcement of hand hygiene, and any policies and procedures that were put in place in the facilities themselves to keep people safe.
Any other questions?
I wanted to just follow a little bit on the declining numbers. Are they declining? I mean, I will follow this. Are they declining more, I mean, not to be too grim, because of death or because of discharge?
Well, I think we're looking at hospitalized patients, which is just a subset of everyone who's infected. And even the folks who die within the hospital, we've had over 100 deaths, are just a subset of everyone who's died from the virus. Many of the patients who've died in skilled nursing facilities never leave the facility because they've asked not to. And so we're really only seeing a slice in time, or a sampling, if you will, of the whole population. I believe that the criteria we've used to admit patients has really not changed. Our skill in managing them has improved. So I do believe that the number of patients who are in the hospital and the number of patients who are in the ICU is a pretty good proxy measure for the overall disease burden in the community.
This actually makes for more of a medical question, because we're spoken about having not been as reliant on ventilators as other areas have been. And so I suppose the question is, are you seeing different medical outcomes as a result of this? I mean, are they better or are they worse? Because it does seem to be an important question if there maybe statewide still is too much ventilator use, but obviously you're not seeing better results, or seeing about the same results.
Yeah, there clearly are better results. The New York experience, the initial experience from New York, showed that 80% of people who were placed on a ventilator did not survive. The early use of non-invasive non-ventilator approaches to ventilation was something we were proud of at Bay State, but it's largely disseminated across the country. The intensive care doctors talk to each other, so I wouldn't suggest today that we're doing anything that's particularly novel, although it was pretty novel 6 weeks ago. It resulted in our having fewer patients in the ICU intubated for weeks and weeks and weeks, and therefore less usage of ventilators, less burden on the ICU. But I think that that particular practice is broadly generalized in the medical community now.
And just one more question. So we start expanding testing to contactees, and just people that are symptomatic. For a lot of the federal government is going to pay for these tests, or at least that's what legislation suggests that they were doing. What should we tell people who might be avoiding testing because they are concerned about it from an economic point of view?
I think that it's important for their health and well-being to get tested. I think that virtually everyone who has any kind of insurance, and that's 97, 98% of the people in Massachusetts, has had mandated coverage for testing. Now, an individual who might be a rare, let's say a non-citizen who is uninsured, might have that dilemma, but we certainly, and I would cover it in some way, shape, or form. We'd make it happen. Fortunately, in Massachusetts, the great majority of our citizens are covered with some form of insurance, and all of them have been mandated to cover this test.
Any other questions of Dr. Kerouac or Dr. Roos? Okay, thank you so much, gentlemen. Stay healthy and stay safe.
Thank you.
We'll open it up to the questions of my cabinet heads or myself. Any questions at all, Paul?
Well, I've got a question, I guess, for both Commissioner Harris and Commissioner Cloud on the face covering
Sure.
issue.
Sure.
Enforcement of that.
I'll have them come up. By the way, on the Superintendent Warwick is working very closely with our team too, is about potential down the road if school reopenings too, if, again, on health, science, and medical.
Will the regulations that the local health board puts in place, will that include a monetary fine for violating the face covering regulation?
Our regulations will mirror that the governor has put out. The governor has proposed a $300 fine for not complying with the face covering, and so we will use that number in our regulation.
And that would work for, that's any individual would be fined $300. Would there be penalties imposed for businesses that let people in without masks, that sort of thing?
We certainly can strengthen what the governor has put in place. We have not considered that to this point. We do not want to, and we've always not wanted to be punitive to businesses because we want them to be able to serve our residents. However, if there is non-compliance broadly, one of the things that the Board of Health can do and does have the power to do is to shut down a business that does not comply with Board of Health regulations. And although we would not want to do that, that certainly is something that is at our disposal to enforce.
Commissioner Clapper, I gather from your comments to the mayor, there's going to be an education period here before people are ticketed and fined. Can you talk a little bit about what your plans are as far as enforcing this new face covering regulation?
As the mayor and I have discussed from the get-go when this started, that mandating and enforcing, it usually does not look good for the police officers if we're out there trying to tackle somebody who's not wearing a mask or, forcing them to give us their ID for their $300 fine. And we've been lucky so far in the city where we've got about 98% compliance. Most people, when it is explained to them why, or we're advising them to do so if they wish to continue whatever it is they're doing, do comply. So I think an added part in that before we start handing out $300 fines is to explain to them again why it's important, and then maybe offer them a mask if they do not have one. So I would be encouraging the officers to do that. especially in the early stages of this mandate, to explain it, to offer them a mask, and then I will take the advice from Commissioner Carlton and the law department on how to proceed if I have total non-compliance.
Have people been, you mentioned people been cooperative, they've been cooperative about the social distancing and not gathering in large groups and things like that, when your officers encounter that, what happens?
So far, it's so good. I mean, we have a couple instances, but those instances that they're non-compliant on the mask, they're non-compliant with the law. So I don't expect that they're going to comply with the mask. If you don't care about, not going to jail or life and death, then no, you're not going to care about the... But for the average person and the majority of people, when it's explained to them, yes, they have complied.
Thank you.
Any other questions?
Just a follow-up on time, I just want to clarify, Commissioner Chris, you said that there is a $300 fine in the governor's order, but the language is a little bit different than others. It's impressive about like what Cambridge and Somerville done, where it's like $300 period, no matter where you are, if you're outside your house. This is not as severe as that. If you're by yourself walking down the street, nobody's gonna, this is not intended to affect you, correct?
You're correct that the language does say if you are unable to physically separate from anyone for 6 feet, then the requirement is to put a mask on. So the governor's guidance really is very loose in terms of being able to do that $300 fine. If I'm walking down the street with you and we're 6 feet away from each other and we're walking, technically we are following the governor's order. Will we in the city of Springfield put stronger measures in our regulations? Right now, that's not what we're anticipating, but it certainly is something that we can consider. But we want to remain consistent with what the governor has put out for the Commonwealth.
Thank you. Any other questions at all? Okay, hearing, yeah, go ahead.
I'm sorry.
Go ahead, Paul, it's okay.
Oh, this is actually it's either for you or for Ian.
Sure.
Is the city planning to do any kind of a housing assistance program? My understanding is some of this CARES Act money is supposed to go for housing. And I know there are other municipalities in the state. Boston, for one, has a rental assistance program. In fact, I believe they actually sent some checks out already to help people out. Is the city planning to do
I'll have Director Sheehan answer that. And just to go back on the mask, I want my police officers, as they have been doing, taking those repeat violent criminal offenders off the street, not making confrontations pertaining to masks. If and when a situation arises, has been pretty good now, where health and police have to work together, they will. But let them worry about taking repeat violent criminal offenders off the streets and have our courts, which isn't open, keep them off our streets. Director Tim Sheehan.
In the action plan that I referenced that's going out for public comment this week, there is a provision in that plan for rental and mortgage assistance.
Do you know how large what that recommendation is as far as how large the fund would be?
I want to say it's over $400,000 off the top of my head.
Has there been any consideration to using money from the Community Preservation Act for rental assistance? Because I understand that there are some communities that have done that, and that's something that's allowed in the law, and when they changed it after the 2008 recession to allow that money to be used. Is there any chance you could get into some of that money?
The resource, that particular resource, isn't that big to begin with, but there have been some preliminary conversations about that.
Director Sheehan, a quick follow-up. Is there any plans either in your action plan or long-term to have assistance to businesses to make themselves more compliant with COVID safety? You know, certainly people might have some financial difficulties paying for that themselves.
That's part of the whole issue that we're looking at relative to reopening. We're anticipating that, there's going to be a lot of compliance issues around social distancing, that businesses are going to have to put new infrastructure into their facilities in order to be able to be compliant. And that's kind of what we're honing in on with regards to the small business assistance coming forward.
Any other questions?
Okay, question.
Sure, Paul.
Mayor, sort of related to this, sort of not.
Sure.
31 Elm
Yeah.
last week. Do you expect that project stay on course since housing construction is something that's allowed on
Yeah.
the current emergency declaration in Massachusetts? You envision that project, the original timetable, I think, called for actual construction to start this fall. Is it still on track for a fall construction?
We wanted to, as long as we're able to continue with the health science and medical, we wanted to move forward, and this has been lie dormant for 30 years. I'm very proud of my administration, a great team, and Opal Wind never gave up on it. Governor Baker's been a great partner, MGM, and we asked them to direct it because when the ULI report came out in my days at the time with the control board and Mayor Ryan, number one priority, the shot in the arm, was to get that historic building back to its grandeur, and that's what we're going to do, and that'll mark another initiative that some people said would never happen in the city of Springfield. So we're ready to move forward on that. I want to thank my internal team. Worked very closely with that, beginning with Kevin Kennedy, Tim Sheehan, Eddie Pakula, Tommy Ash, Tommy Moore, nearly at times daily, and working with the Secretary Keneally and Governor Baker to make sure we advance this thing forward. And that's going to be a very stately building, and the historic Court Square. They'll look out of the grand facade, glass facade of the Mass Mutual Center. So it'll be another piece of the puzzle on that. So we're looking to move forward. That'll also be my brothers and sisters in labor, building trades. They will be working that, so many construction jobs will be created, and many other jobs will be created in market rate housing with a small component of workforce housing, and then a retail component on the first level. So, yeah, we're anxious to get going, and that's going to move forward. I think with the COVID-19 and the coronavirus, that has thrown us all a curveball with all our people. It's important that we still have to dictate our future. So working with Director Sheen and others, we're going to continue to try to move that forward based on health, science, and medical type aspects. But that we have to continue to dictate our future and move forward. As important as it is, number one priority is to starve and kill this virus. 1A priority is getting people back to work, economic lifeblood. And that's key. So I go back to the one word: confidence. You got to build public confidence, you got to build business confidence, and you have to build consumer confidence. So we're going to have a can-do attitude. My administration's always had a can-do attitude, and at times some people like it, some don't, but I can be forcefully, diplomatically aggressive, because you got to drive a train. You got to make sure that train's going in the right direction. People want to get on board, that's great. You don't want to get on board, the exit's right there. So, yeah, we're very happy about that. Any other questions? Yes. Okay. Sure, Chris, come on up.
I know a lot of cities and towns in the area have been scaling back on their projects, their road projects and things like that. Is that an issue that you're having with any of the projects that you have here in the city?
Right now, no, other than that they've been starting a little slower this year. Instead of having a huge group of people starting the first week of April or so, it was a slow, gradual increase of employees. One of the concerns that I know a lot of companies that I talked to were concerned about changes in the requirements from the government as to who could work and who couldn't work. And what they were afraid to do is a lot of their employees are on unemployment during the winter. They didn't want to bring them back and then put them back on unemployment, et cetera. But as far as the city is concerned, everything is moving forward. Our projects that we have ready for construction are going to be starting. And we have a number of projects. We have a number of projects right now out to bid. I mentioned Central Street and our paving projects, and there will be another 2 or 3 later this year that will be going out. So right now we're moving forward. Right now the only entity that really isn't doing major work in the city is Springfield Water and Sewer, Columbia Gas, Comcast, Eversource. All of those entities are working.
Thank you very much to everyone, and again, we will get through this. That's the end of the press conference. We will get through this as one together and for the better. And again, I deeply appreciate the TV media and the radio media that is here to get the word out, and I appreciate the patience and understanding of our residents and business community. Have a great day. Thank you.